Welcome to This Explainer. Today, we're going to unpack the surprising medical realities of ear care. Look, we all want to be clean and healthy, right? But today, we're going to take a really close look at why your daily ear cleaning routine might actually be doing significantly more harm than good.
Okay, let's dive right into this. It seems completely logical. We wash our hair, we wash our face, so naturally we should clean out our ears. But the fascinating reality is that doing it yourself is actually one of the leading causes of painful ear problems. To truly grasp why our instincts are completely backwards on this one, we really need to understand the biology at play.
All right, Section 1. The truth about earwax, cerumen, and protection.
So, to understand why cleaning your ears is actually dangerous, we first got to look at what's really happening in there. Most of us just think of earwax as dirt or maybe a sign of poor hygiene, but medically, it's called cerumen. And cerumen isn't dirt at all. It's actually your body's built-in defense mechanism. It's totally naturally occurring, and its entire purpose is to protect the delicate structures of your inner ear from harm. Believe it or not, you actually need it.
There's a really delicate biological balance here. Having a little bit of wax is absolutely necessary and protective. But on the flip side, we have impaction. So when does it become a problem? Well, when there's an overbuildup. Now, this can happen because of certain diseases that affect how our bodies produce earwax, or even just as we age and our natural production changes. But the biggest culprit? Actually, it's our own bad cleaning habits that end up pushing that wax way too far, turning a natural protector into a painful blockage.
Moving on to Section 2, Symptoms of Earwax Impaction and Warning Signs. Let's see what happens when you cross the line from healthy protection into a full-blown impaction. First off, you might have an impaction and literally not even know it. You could be completely asymptomatic. When symptoms do pop up, hearing loss is incredibly common. People will suddenly realize everything sounds kind of muffled. But a wax blockage can surprisingly trigger some much stranger things too. You might feel this weird fullness, a constant ringing, or even get dizzy and lightheaded. And get this, an impaction can even cause severe itchiness or trigger a random, unexplained cough. It is absolutely wild how connected our ear canals are to the rest of our nervous system.
Which brings us to Section 3, Keep these objects out. Let's talk dangerous habits.
So, what actually causes this impaction to get so severe? Look, we all get tempted to dig in there when our ears feel full or a little itchy. But honestly, you would be shocked by the everyday objects people use to secretly wage war against their eardrums behind closed bathroom doors.
It sounds completely absurd, I know, but these are real items medical professionals see causing severe damage. People are actually using sharp objects like their house keys, bobby pins, and even metal pimple extractors to dig out wax. And of course, the most common culprit of all, the Q-tip or cotton swab. The problem with literally every single one of these items is that they don't actually solve the problem. They just cause further impaction by packing the wax down tighter and tighter. Worse, using sharp objects puts you at a massive risk of literally rupturing your tympanic membrane, that's your eardrum, which can cause permanent damage.
And, well, let's not forget our favorite daily accessories. Even your everyday earpods require some serious caution. We aren't saying you have to avoid them completely, but just look at the mechanics here. When you use them constantly, you're physically jamming any existing wax backward into the canal. Add to that the fact that you're now simultaneously blasting loud music right into a compromised blocked space, and, well, you've created a serious double threat for your ear health. You really have to keep the volume down and just be cautious about how far you push them in.
All right, Section 4, the ear candling myth and dangerous trends. Next up, we need to tackle this huge internet trend that promises an easy fix for your earwax woes, but actually makes things incredibly dangerous. I'm talking about ear candling. The web is just full of claims about this. The idea is that you take a hollow candle, stick one end into your ear canal, and literally set the other end on fire. The claim is that the warm moisture created by the candle will magically act like a vacuum and suck all the earwax right out of your head. It sounds like this amazing ancient remedy, right? Well, let's look at the stark medical reality of this procedure.
So here is the absolute most crucial point. Medical professionals explicitly and urgently warn against this trend. You absolutely need to avoid it entirely. Not only does the supposed vacuum effect simply not work, but you are literally playing with fire right next to your face and a very, very delicate organ. The severe risk of horrific burns and physical injury to your ear canal far, far outweighs any fictional benefits you might read about in internet articles.
Section 5, Healthy Ear Care Habits and Best Practices. Okay, so if Q-tips, house keys, pimple extractors, and literal fire hazards are completely off limits, how on earth are we actually supposed to safely handle our ears? Well, the surprising yet incredibly simple answer is the ultimate golden rule of healthy ear care: keep sharp objects out of your ears entirely, and just let the ear do what it was biologically designed to do. The best DIY ear care is literally leaving them completely alone. Your ears are basically self-cleaning ovens. They naturally migrate the wax outward entirely on their own.
But, what if you actually do have a problem? If you develop hearing loss, that weird feeling of fullness, or even that bizarre unexplained cough we talked about earlier, please don't try to excavate it yourself. Reach out to the professionals. If you're a student, follow up with places like Student Health Services. Just hop onto your secure patient portal, shoot them a message detailing your symptoms, and let trained medical staff handle the safe, effective removal of the impaction. They have the right tools that definitely won't rupture your eardrum.
We've seen the mechanics of earwax, the hidden symptoms of an impaction, and the extreme dangers of DIY excavations. So I'm going to leave you with this final, kind of provocative thought to consider the very next time you step out of the shower and reach for that bathroom cabinet. Are you genuinely willing to risk permanent hearing damage just for the fleeting 5-second satisfaction of using a Q-tip? Let your body do its job and leave the sharp objects in the drawer. Thanks so much for joining me for this explainer, and remember to keep learning.